Hello, everyone. My name is Ticarla Gothi, and my topic is physician assisted suicide. Physician assisted suicide is when a doctor facilitates the death of a person, either by providing them the necessary means to do so or the information to do so. An example of this would be, say, a physician prescribing sleeping pills for a patient and also telling them the lethal dose to take to end their life. He doesn't foresee end the life for them, he tells them what to do to end their life. And so that's what physician assisted suicide is all about. It's called assisting because the doctors do not actually take the person's life. They provide the means to do so. And this topic is sensitive to me because I've worked at a a cancer center for the past 3 years, and I've seen how the patients come in and how they're suffering with these life-threatening illnesses, terminal illnesses really, because they're not going to live. They're not going to survive the illnesses that they're dealing with, and all the pain and suffering and the sickness and not being able to enjoy life anymore, not even to enjoy food because they have no taste. The medication takes the taste away from the mouth. They have this metallic taste in their mouth, so no longer can enjoy even the simple things like eating food. So they're losing weight. They're having to quit work. They don't have the necessary means to even come and pay for treatments. They're having to get all these grants and loans and just to try to live and try to sustain life, which is going to end up taking them out anyway. So they're leaving all these medical bills to their families and to having to take care of, and they no longer have any quality of life. And then they are suffering from things that are really out of their control, and they'd rather just have patients to tell me they'd rather just take their own life and die with dignity and not let the disease take them, and they'd rather just end it all themselves. Physician assisted suicide is actually illegal in only 5 states in the United States, and those states are New Mexico, Vermont, the state of Washington, California, and Oregon, which Oregon was the first state to actually legalize physician-assisted suicide in 1997. And it stated that the patient had to be 18 and had the mental capability of saying, I want to end my life. This is not what I want to do. I don't want to live like this. And they had to be able to administer the lethal dose themselves. So that's what physician-assisted suicide is all about. It's about the physician assisting the patients with ending their life, not actually doing it for them, which would be murder. And also in my research, I stumbled across a well-known, infamous doctor by the name of Dr. Jack Kevorkian, who performed over 130 assisted suicides between 1997 and 1998. Well, Dr. Kevorkian was actually the first to assist a patient in dying, and by the name of Janet Atkins, and who was suffering from Alzheimer's, and she decided that she no longer wanted to suffer with a debilitating disease, and and Dr. Kevorkian assisted her with ending her life. And she did so with his death machine that he created out of $30 worth of scrap metal, and which she administers potassium chloride to herself, which caused a heart attack. And that's how he would provide these patients with their deaths. He would, with this death machine, he would allow them to administer the medication themselves. He actually went on trial for that, and it got acquitted, but ended up serving 8 years because he actually administered a lethal dose himself to a patient, and was convicted of second-degree murder. But physician-assisted suicide, it would help cut the cost of health care dramatically, because you're having to pay for your treatments, which sometimes one treatment of chemo can cost you $50,000, and no one in there could, let's say a normal person cannot afford to pay $50,000 for one treatment, and they're having to quit work, and then their families are left with the burden of trying to cover healthcare costs, and also being able to end your life with dignity and on your terms. It would allow a person to have, control of how their life is ended and not let these illnesses take their life. So